Hi, everyone. Thank you for joining the 4th annual Refugee Health Symposium. This is a multidisciplinary annual event that brings together refugee health experts in the fields of medicine, law, mental health, and public health. The symposium focuses on current issues every year, and this year we'll be focusing on the 2021 crisis in Afghanistan, and the resulting forced migration that has hit particularly close to home, with many new Afghan arrivals resettling in the Bay Area. I forgot to present myself. I'm Eva Rafael. I am an assistant professor in the Department of Epidemiology and Biostatistics and a family medicine practitioner at UCSF. And I'm pleased to present kind of give the opening statements for this year's Refugee Health Asylum and Asylee initiative. Oh, sorry, I have a baby in my arms, so I apologize, everybody. This is what happens when nobody is here to hold my baby. So anyways, I will quickly move on. So this symposium is put together by the Refugee Health Initiative, which is led by Dr. Fatima Karaki. So Dr. Fatima Karaki is an associate professor in the Department of Medicine at UCSF and a national leader in academic refugee health. She's both the founding director of the Refugee and Asylum Seeker Health Initiative, but also founding member and board member of the Society of Refugee Health Providers, as well as co-chair of the SRHP Research Committee. Dr. Karaki has published numerous refugee health research articles in medical journals and has developed graduate-level refugee health coursework. She also has extensive volunteer experience providing medical relief in refugee camps in the Middle East, Europe, and South Asia. So go ahead, take it away, Fatima.
Thank you, Eva, for the introduction, and it was nice to hear your beautiful baby. Welcome, everybody, and thank you all for taking the time to attend this event. For those of you who don't know me, my name is Fatima Karaki. So I'm the director of the Refugee and Asylum Seeker Health Initiative at UCSF. Our mission is to improve refugee health, and one of the many things that we do is we host this symposium once a year to take the time to highlight the important issues in refugee health, particularly the things that have happened over the past year, and provide the community with a forum to learn and collaborate. Next slide. So anyone who's heard me talk before knows that I always show these pictures of my village and my father's farm in Lebanon. Next slide. And this is a picture of a Syrian refugee who lived on our farm in Lebanon. So the way I got involved in refugee health is that there were a lot of Syrians living, over 1.5 million of them living in Lebanon during the Syrian civil war. And I say that because whenever you hear somebody talking about refugees or refugee health, I think it's important to try to understand that person's motivation and where they're coming from. So all of our speakers today not only have impressive expertise in their respective topics, but they also come from the affected communities or are closely tied to them. We make a really big effort at RAHI to empower communities to speak for themselves rather than having other people speak for them. That's one of our main values. And we do have a very passionate symposium planning committee. So I do just want to take a moment to acknowledge all of the efforts of Stephanie, Nasreen, Ala, Eva, Katrine, and Paris. Thank you guys so much for organizing this event. Next slide. So I will be moderating this very important session looking at the recent influx of Afghan newcomers. But first, I did want to take a couple minutes to reflect on our organization. Usually at the beginning of the symposium, I give an overview of refugee health globally, but this year I wanted to do something a little bit different because we have had a really productive year. Many of you may know that when I founded RAHI, one of our core beliefs was that through refugee health research, we could get a better understanding, a deeper understanding of the health issues that face refugees. And that would enable us to better address their health problems and improve their quality of care. And so this year we have produced quite a bit of research, and I do believe that it's had a meaningful impact. Next slide. Here I've listed a few of our publications this year. You can see that we try to address a wide variety of refugee health topics in a diversity of different populations of refugees and displaced people. So For example, we have articles examining the disease burden in Syrian refugees in Lebanon. That was actually the first project that we got involved in with RAHI, and that's a credit to Ola, who's one of our hosts today. We also have a couple of articles discussing the COVID vaccine as a health equity issue in refugees, both in the US and internationally. And there's too many co-authors here to list everybody and give them credit individually, but you can see that we work with very smart people, people much smarter than me, and many of our co-authors are refugees or resettled refugees themselves. And so we do believe at RAHI that having refugees design and execute the research that is looking at their communities is very important. And so that concept of research justice really drives us. Next slide. So a couple more publications here. Oh, go back, thank you. A couple more publications here. You can see we have one article talking about refugee reproductive health led by our ReproNet group at UC Davis. That's with PI Dr. Heike Tilde Bocanegra. We have another article talking about establishing an international refugee health research committee with our international society, which you can join if you're interested. And then I really want to highlight this last article published in Nature Sustainability by Ben Wynn's team at Stanford. So this last article talks about a decaying oil tanker called the Safer that has been abandoned off of the coast of Yemen. And this oil tanker is carrying 1.1 million barrels of oil, and it's at imminent risk of a massive oil spill into the Red Sea, either due to leaking or an explosion. So this research article was actually inspired by last year's symposium, which some of you may remember focused on Yemen. Next slide. And so that article actually received quite a bit of media attention from outlets like CNN, BBC, Al Jazeera. And that was great, but actually more importantly, Ben Wynn also worked with Greenpeace. Thank you. So he worked with Greenpeace to produce a report on this work, which was presented to the UN. And as a result, the UN recently came to an agreement to offload the oil from the tanker. Next slide. So you can see in this recent UN news article from just a couple of weeks ago that they have an agreement to offload the oil from the tanker. It hasn't happened yet, but we're very hopeful that it will happen soon. And so I just want to congratulate Ben and his team. This is a really great example of how events like this symposium can lead to this really wonderful chain of events where the symposium increases awareness and leads to meaningful research. And then that research translates to advocacy and changes in policy that impact the public health of millions of people, literally. So that's great. Next slide. Of course, we also work on non-research projects as well. So for example, clinically, our team at RAHI produced this patient care brochure that highlights the best practices in treating refugee and asylum seeker patients and the unique needs of those patients. So this guide is available for download on our website if you'd like to read it. And I'll also send it to everybody after the event. Raising awareness of refugee and newcomer patients and what they need is really crucial. And I was actually able to give UCSF grand rounds last year to talk about that and raise awareness among our own community at UCSF. Next slide. So I'm not going to give an overview of global refugee health this year. It's a whole separate topic, but you can see from these mid-2021 numbers that unfortunately the number of people facing forced displacement continues to grow. And we have more refugees and asylum seekers and internally displaced people more than ever. Next slide. And those numbers don't even account for the people who were forced to flee Afghanistan after the crisis in August 2021. The exact numbers from that crisis still have not been published, but we have all seen the news coverage and the distressing pictures of the evacuations. And as a result, many Afghans have come to our country, and that's what we decided to focus our symposium on today. The Bay Area actually is home to the largest Afghan population in the US, and so many of the Afghans coming to our country have resettled in this area. Next slide. I'm gonna leave it to our wonderful speakers to talk and teach us more about Afghan newcomers recently here. But before I do that, I will announce a new project with RAHI that focuses on some of the Afghan refugees that have actually been resettled, not here in the Bay Area, but in Michigan. So there is not a large Afghan community to receive them in Michigan. And so over there, they have really struggled with limited cultural navigation, limited language access, and limited resources. And so we really wanted to leverage the Afghan community here in the Bay Area and connect them to resettled Afghan refugees in Michigan to help. And we're working with an organization called Zaman to do that. So if you're listening and you're Afghan or Afghan American and you're interested in mentoring some of these Afghan refugees and refugee families in Michigan, please email us to sign up for that. My last announcement is that we are going to expand our operations into Southern California mostly because I'm moving to Southern California, but we are gonna, of course, maintain all of our work here at UCSF and in the Bay Area. Many of you know that all of our work is done by volunteers. We do not have any formal funding, so we do rely on your donations. So if you like what you hear today, please visit our website, learn more about our work, make a donation to support us. There's going to be a QR code during the break that you can scan if you'd like to donate. And we just appreciate everybody taking the time to attend with us today. We're so excited to be here. With that, I am going to go ahead and open up the panel. Our first speaker is Khawaga Ghani. She's a visiting scholar at UC Berkeley and an Afghan journalist. She worked for NPR, Amnesty International, and other international media, including Vice News, the New York Times, and National Geographic. Khawaga has completed her Bachelor of Arts in English Literature at the International Islamic University in Islamabad, Pakistan. And she's now working with the Human Rights Clinic at University of California, Berkeley on research projects concerning Afghanistan. Khawaga is joined today by her mother, Gulalai Haidari, and they're going to speak with us about their recent journey and experiences coming to the United States. Thank you so much for sharing with us, both of you.
Thank you so much, Fatima. It's really nice to be here among all these great people today. My name is Khawaga Ghani, as Fatima just introduced me. I'm an Afghan journalist. Recently came to the US. I'm living in Bay Area in Fremont right now. This is my mother, Gulalai Haidari. She has been a great teacher and a wonderful woman. And she has been an inspiration for all the family, all our lives. So yeah, we recently came and went through a lot of challenges on the way coming to the US, spent 2 weeks on the way until we got to Wisconsin, and my mother has diabetes, and we lost our luggages on the way to Wisconsin when we got to the camp. I was so scared when we got there, and I didn't know what to feed my mom so she can maintain her diabetes, and she actually did not eat for days. So I was really, really, really concerned. And then I found a friend at, she was working with the State Department, and she became a really good friend of mine. And I asked her if she can help me with something with the medicine, or maybe if I can take her to a doctor. They had a little small clinic, and they had a lot of patients every day. A lot of patients were standing in the sun waiting for their turn to be checked or to get medication, even for a headache. And then my mother had a bigger problem, and I couldn't take her, make her stand in the sun for a long time. So I would go and stand in the line for her and let her wait until I get in. So this friend of mine, she helped me. I got in and I took her to the doctor, and the doctor checked her and then gave her the medication that she needed. That was it after 2 weeks that we spent at the camp. So she did not have her medication until 2 weeks. And we got done with all the process at the camp, and we came to the Bay Area after all the process was done, and she did not have health insurance. I had to look for a health insurance for her so she can go ahead and get checked, because her medication was being finished and she had to find a medication for herself. there were a lot of Afghans helped me as well. They took her to a doctor, a diabetes specialist, and she went to get her medication again for another month until I find my way how to get her health insurance so she can go ahead and be checked properly. And yeah, I finally found a way how to fill forms, and go to the county and find a way to get my mom health insurance. And my father was going through a lot as well at the same time because he has chest infection. So yeah, when another month went by until we got the health insurance for both of them, and then I took her to the doctor, found a doctor for her so she can check, and then she sent her to another doctor. We got her, the first thing she gave her was a mammogram. So I took her for that, and the result came out and they said she has a lump in her left breast. And the lump was there for a long time, but it never bothered her at all. But after the mammogram results came, the doctors told me that it could be something serious. And kept on like going to appointments from here to there, and got an MRI done. And at the same time, she found another problem of hernia, that she could not go to an MRI and stay there for like 30 to 35 minutes. They told her that you have to go back. We can't do the MRI now. So another month went by, and after a month, they gave us the results that it probably will be something that will be dangerous for her, and we need to probably see a surgeon who is a specialist, and they can tell you what they need to do. And that appointment took two other weeks, so we can go ahead and the doctor can see her and tell her what we need to do. A lot of stress was going on. I didn't know what to do, because all the information was coming to me, and I am the focal point between her and the doctors, and she doesn't know how to speak the language. She understands everything, but she cannot speak. So the doctors called me. The appointments are all being done by me. Like, I take her everywhere. I didn't know what to do. So I called my uncle. I was like, I don't know how to deal with this. Can you help me? And then he went with her to the doctor, and they said, yeah, there probably will be something at stage 2 or something. And then she gave another appointment a month later. So we are all scared, and we don't know how to handle the situation, how to go and see another doctor, because I'm new, I don't know anything. And whatever I use the language that I know, so I can speak to everyone and ask them, how am I supposed to do things? And about health and stuff, I don't know anything. I have no idea how it works here. Because in Afghanistan, I would just call the doctor and tell them that, this is what the problem that we have. When can I see you? And the doctor would say that you can come tomorrow. And I would go at that time. The doctor would see me and give me medication. I'll go buy the medication, and that's it. But here it's different. Everything is different for me. And it's not easy to go around things here, especially if you don't have like the health insurance. Then even if you're dying, you can't do anything about yourself. And and then I called her physician, and I told her, I was like, I need her to go to someone that I know and we can trust. And then my uncle told me, like, we should transfer her to UCSF at any cost. So I called the physician. I was like, can you please refer her to UCSF so we can go ahead and do all the other treatment there. And then yeah, she's really nice. She did that for me in a day. I kept calling her uh, every 2 hours that, did you do it? Did you do it? Did it happen? And then she said, yes. I referred her, you can contact UCSF. And then I contacted UCSF and they told me that, yeah, she was referred by this doctor and she can go ahead and do her treatment here. So we started the treatment. It started last month, and she has another appointment for MRI and PET scan on the 27th at UCSF. And then she's going to go ahead from there, and let's see what they decide to do there. And yeah, like there's so much going on. I don't know what's going on with me right now mentally, because there's so much stress. There's trauma that I've been through. I don't understand it right now, but sometimes when I sleep, and I dream about what happened, and I feel like I'm still there. I am at the airport in Kabul, and I can't get out. So all of this is all mental problems that we have, and there are so many other people that I come across, and I see them and I speak to them. They're new refugees and they're going through a lot. They don't know how to. I know the language, I know how to use a computer, but those people who are here, they don't know how to use a computer. They don't know how to fill a form. They don't know how to speak. I'm wondering, because I spoke to one of the new refugees who came, and he was an old man and he didn't know the language. He didn't know how to go and buy groceries. And he had a lot of health issues. And I spoke to him, and he told me that I don't have a computer. I don't know how to fill a form. I don't know how to apply for my health insurance, and I don't know what to do. So there are so many people like that who have these kind of problems. They don't know, they don't have a person who can speak on their behalf, and they can go ahead and do something for them. And I think my mother here, she used to be my teacher, and she was the one who really pushed me to everything, like go learn English, go learn computers, go learn this, go learn that, so you can be on your own, and there's going to be a day that you're going to help me. And today is the day that I really did try to help and do something for her. And yeah, she's strong. She made me strong. Yeah, this is all. Thank you so much for listening. I spoke too much.
Thank you, Juaga, for sharing your story. I don't think any of us can imagine how difficult that must have been for you and for your mom. And it's so nice to hear that she's finally able to get treatment. And some of these stories of coming to a new country and figuring everything out are so hard, but the main message I heard from you and everything you said was love, of how much you love her, and your love for her made you advocate for her till she got what she needed, just like she loves you. Yeah. So thank you
so much.
For sharing
Thank you.
that.
Thank you.
Our next speaker is going to talk a little bit about some of the numbers of new arrivals that we've had in the area. Nuni Kabanting, MPH, is the currently the epidemiologist of the Office of Refugee Health in the California Department of Public Health. She has over 20 years of public health experience in research design, data analysis, and surveillance and program management. I'll refer you to our program for all of her past experience, which is extremely extensive, but for the past 10 years, she's worked for the Office of Refugee Health in implementing and maintaining a health surveillance system known as the Refugee Health Electronic Information System. She conducts research studies highly developed in scope and complexity to assess health status among refugees in California. And she's also interested in improving health disparities among populations with various cultural backgrounds and addressing health literacy concerning health promotion and prevention. So we heard the story of just one recent arrival, but Nooni is going to talk to us about some of the numbers of people coming in and where they are and their epidemiology. Thank you so much for teaching us, Nooni.
Well, thank you, Dr. Fatima, for this opportunity, and good afternoon, everyone. Yeah, the story of Kwaga and what she shared was really touching to me, because I'm coming as a refugee. I can relate in all aspects, you know, trying to come in and navigate and help your parents, and definitely felt that. So thank you for this opportunity. Like Dr. Fatima said, I'm here as part of Office of Refugee Health. I'm presenting on our program. Next slide. Just want to. All right, I'm just going to provide some brief overview of our program before we get into the data aspect of this presentation. As part of the Office of Refugee Health, one of the programs we do coordinate and manage is this Refugee Health Assessment Program, known as RAP. So the eligible populations we serve is refugees, asylees, special immigrant visa, victims of trafficking, human Haitian entrants, and then this new Afghan humanitarian parolee, which we refer to as the AHP. So RAP, the RAP program is to help improve the health status of refugees. And this is also including the follow-up with medical issues identified overseas, at the safe haven sites, especially those who arrive pregnant. We're getting a lot of women that are arriving pregnant, needing prescription refills upon arrival and needing immediate medical attention. There's also part of the program is the requirement of the health assessment within 90 days upon arrival into California. So we help coordinate that. Well, our county health programs are the ones that kind of administer those health assessments at the programs. And then the early identification of communicable diseases, chronic diseases, providing that mental health screening and immunizations. And also, and lastly, is the referral to the primary care providers for the ongoing care. I think it's really important for them to continue that continuity of care once they arrive into the US. Next slide. So these are kind of a map of all the programs that we have. We have 11 counties, local health jurisdictions within California that serve refugees or provide this health screening assessment. And we're continuing to grow and add as we go, and as more refugees resettle outside of these counties, but these are our 11 main sites. Next slide. So this is kind of, here's a comparison of, just want to kind of touch base on what our traditional medical screening of our refugee arrivals versus what our current medical screening, the pathway of this recent Afghan arrivals that came in August. So the main difference I want to kind of point out is that there's no medical screening prior to leaving the country. As you know, it was kind of all happened fairly quickly. So there's none of that. And then also there's the basic medical screening that is administered at the safe haven sites. As we know, it's just more of the acute conditions that they're addressing, more of the physical exam, TB screening, and certain vaccinations. So that's why it's really important for refugees, once they arrive into their final destination or the community, that they do come see one of our programs, if there's one close by or within their county, for a health assessment. Next slide. So I mentioned a little bit about how the refugee county health programs collect this health assessment screening. We have what we call our Refugee Health Electronic Information System. This is our web-based database that collects and stores all this health information. This is basic data indicators that are consistent with CDC recommendations and guidelines. We collect everything from mental health, immunizations, patient medical history, diagnosis, everything across the board. And really, we want to just really improve and standardize the quality of the data that is collected so that we can, in turn, be able to analyze it and provide meaningful health data reports that we can share with our stakeholders. Next slide. So this is kind of a table of just historically what the arrivals that we've been seeing for the past 5 years. As you can see, more recently, current fiscal year 2022, we've kind of shifted and the number of Afghan humanitarian parolees that we've seen. And this number, this 3389, is continuing to increase as we are now getting that second wave of Afghan arrivals that are at the safe haven site in Virginia. So historically, we've been seeing at least approximately about 40% of Afghan arrivals nationally that come into California. And that's continuing to increase, I think, as time goes by. And then the proportions here, you can see it kind of shifts on that last recent year, or most recent year. So this is just more of a snapshot of the 5 years of all the different entry status that we see. Next slide. This figure shows more of the top 10 countries of origin that have resettled into California. Obviously, Afghanistan being the top there, followed by Ukraine, China, Haiti. Again, these all includes refugees, asylees, special immigrant visas, and the Cuban Haitian entrants. But just to point out that Afghanistan have historically been our top country that we receive arrivals or newcomers to. Next slide. And here I just want to highlight most recent arrivals of our Afghan humanitarian parolee. This is, when I say fiscal year 2021, this is going to be from August 1st of 2021, comparison across the board. So these are all our counties that we see, the impacted counties that we get the Afghan arrivals. Just a comparison, close to 50% of those that arrive into California are arrive into Sacramento, followed by a lot of those San Diego, LA, and also the East Bay County, Alameda, and Contra Costa. But overall, most recently, the current year, we saw our AHP, higher proportion of them are being seen at our counties versus the other entry status groups. Next slide. And a quick snapshot of just this ICD-10 diagnosis. So these are one of the sections that we collect data on. And what we see is that a lot of them do come with a lot of parasitic infections, mostly across the board for those kids and older adults as well. And then the younger than 18, the abnormal high lead levels that we're continuing to see. And that's kind of the pattern that we've been seeing historically. And then what else? And then LTBI as well for the older, the adults of 18 and over. Next slide. All right, and then this is just the health outcomes, just to kind of briefly, this is what we've been seeing in terms of screen positive, hepatitis, TB, parasitic infections, and again, just the blood levels among the 0 to 17. Next slide. I just want to quickly point out that we do see a lot of about 50% in our Afghan are women, and then we've seen that about 14% of those do arrive pregnant. And so these are some of the pregnancy comorbidities that we've seen related to that. And then the percentage is a little bit higher among the Afghan, the AHP that we've seen since the arrival of August. So just a list of some of those comorbidities. Next slide. And just to point out some of the challenges we've kind of encountered while going through this postures, this happens so quickly and we're having to adapt and adjust as we go along with what's happening. But a lot of them we've seen that a lot of arrivals that are departing independently from the safe haven sites, they're not being assured to resettlement agencies. So that's always been a challenge, trying to connect them to care. And so we've tried to think of creative ways to kind of how to get them in, but they've been also, a lot of these counties have been impacted. This overlap of, the quarantine requirements with the TB and IZ screening that don't go through the safe haven sites. And then again, just the volume of arrivals that are coming into our counties. And then lastly, just one thing to point out is the arrivals to counties without refugee health programs. We have a lot of neighboring counties like San Joaquin, Riverside that can kind of be seen at the neighboring counties, but these remote locations. So we've developed this tool, next slide. It's actually posted on our website, so feel free to visit that. It's our clinician guidance, and we just encourage providers also to use this, for any migrant population in California. it's also good as a tool for clients as well to use as a, kind of a self-advocacy tool that they can bring to their PCP appointments. And it's also requirements. It lists requirements what they would need for adjustment of status or a green card. So these are also what they would qualify, as well as medical care. So all this information is on our website. So definitely feel free to visit that. And just our last slide here, opportunities. So yeah, with all of this, we have been able to, been great to partnering up with FQHCs to create ways of how we can see these individuals. And, we've been blessed with kind of a public health officers that have come in and helped us kind of case manage some of these individuals that are waitlisted, our overflow. A lot of our clinics, our county programs have been amazing in setting up like health fairs, mobile clinics, weekend appointments, to just however they can to see these individuals and allow them to be seen. But for the most part, they've been great. And this is, we're continuing to learn the process as we get more arrivals coming in. And next slide. And again, feel free to reach out to myself or Dr. Christine Murto. Her address and my email address is listed here along with our website. Thank you.
Thank you, Nooni. I need to book you for a separate talk so you can talk for a whole hour, because I learned so much from you. Just
I know it's a lot of information. I'm just like,
but those tools that you've developed to ensure, certain quality metrics, I think have probably made a really big difference
for sure
in people's quality of care. So thank you for that. Our next speaker is Dr. Jessica Wong, MD. Dr. Wong attended the University of Michigan, which is actually where I went as well for her undergraduate education. She went to Yale University for medical school and University of California, San Francisco for internal medicine residency as part of the San Francisco primary care program. She is a primary care physician and interim medical director of Eastmont Wellness Center at Alameda Health System. She oversees Alameda County's Refugee Health Assessment Program, which provides the initial medical care for refugees, asylees, and other special immigrant groups. This clinic has long served Afghan SIVs, and since August 2021 has worked in overdrive to connect Afghan newcomers to primary care. So today, Dr. Wong is going to share her experience directing this clinic where many, many Afghan new arrivals are seen. Thank you so much, Dr. Wong.
Thanks for having me. Thanks everyone for joining. Nooni actually gave this great overview of what we do because our Refugee Health Assessment Program, of course, is one of the 11 that her office oversees. So my clinic, Eastmont Wellness, is in East Oakland, and we are a large FQHC that has full scope primary care, women's health, optometry, dental, and some specialty services, and then also houses for many years the Alameda County's Refugee Health Assessment Program. And our health system, which is Alameda Health System, is the public safety net system for Alameda County, but we're actually separate from the county, so we're not part of the public health department in Alameda. So like Nooni said, we are charged with doing a comprehensive health assessment within 90 days of the arrival of refugees, asylees, and these other groups. And this comprises of 2 visits, a nurse intake visit where we gather as much of the health history that we can for each person. And then they do a lot of lab work. And then they come back and see a provider to review all that lab work, do vaccines, do treatment, and start them with primary care. And then we try to connect them to primary care. So I'll share that because of political changes that happened, we, like many other organizations that serve refugees, were had to cut services in the sense that we used to see about 600 patients per year, but then between 2016 and 2020, as the refugee ceiling was lowered and fewer refugees and asylees were let into the U.S. We, in 2020, only saw about 100 patients, and most of them were Afghans who had special immigrant visas. And so because of that, we had to downsize, like many of our resettlement agency partners had to. And so when August 2021 hit and this crisis occurred, we and pretty much this, this entire network all of a sudden, had to upsize and figure out how we're going to accommodate the sudden influx of, Afghans and patients, right? So we partnered with the Office of Refugee Health, the resettlement agencies that we work with in Alameda, which is International Rescue Committee and Jewish Families and Community Services, JFCS, and our county to try to plan and make sure that we were helping these refugees as much as possible. So this was, many meetings on a weekly basis for many weeks to try to make sure that we were all on the same page in terms of what social services that they qualified for, how to make sure we were streamlining the process. And then on the healthcare side, how to try to see the patients in a timely way and make sure they were getting the care that we needed. We partnered with the behavioral health services run by the Alameda County for mental health care, and then with other local clinics to help us see this large number of patients. Which was great. Like, it was so great to be able to work with such a wide group of people who were all really dedicated to helping the Afghans. So medically speaking, we see a lot of different things in our refugee clinic. The most common ones Nuni already mentioned, so latent tuberculosis, which we start treatment on. H. pylori infection is extremely common as well. So those are probably our two most common infections. And then there are parasites that we also will see and treat. Our older patients often have diabetes, hypertension, the same chronic diseases that we see everywhere. And then, as Nuni said, a high number of patients who are pregnant who we need to get into care as quickly as possible. Mentally, of course, there's a lot of depression, anxiety, and stress that we try to help treat and also connect them to, community-based organizations who could help, to therapy, to the county if they have severe mental illness. And I'll say that our biggest challenges that we've faced since August have been sort of trying to see patients in a timely way, which is hard to do when you are starting off short-staffed for what you need. So we, have been trying to, prioritize patients who we know have medical conditions that need to be seen, trying to get them seen as quickly as we can as a whole. And then insurance barriers, right? So health insurance is like completely necessary to receiving care in the United States, but it also greatly complicates things. So our services are provided free to patients outside of any insurance requirements. But of course, all of these patients qualify for Medi-Cal, which can be given retroactively. But sometimes if they're waiting for Medi-Cal still, which does of course take time, then it can slow down their process, right? So you can't necessarily get medications at your pharmacy if you don't have Medi-Cal already, even if you can see us in our clinic. Or, you can't really connect to primary care very easily unless we help, if you don't have Medi-Cal set up already, right? And then there are the other issues of the health insurance companies assign you to what clinic you're supposed to go see. You can't just go to any clinic for primary care. But these patients have moved around a lot, right? They settle into a temporary place that's provided by a resettlement agency, for example, and then they get a hotel in a completely different city. And so maybe the clinic they're assigned to is very far away now, or maybe it's not our clinic. And so they can't come back to see us, even if they want to. And so you have to either wait for the insurance to update their medical home, or, they have to go to a different place. And so trying to help patients with health insurance related, Medi-Cal related issues is a big part of what we do as well. Yeah, so that's just some of our experiences that we've had. I'm happy to answer more questions.
Thank you, Jessica. It was really fascinating to hear about your experience. And, for us born and raised in the US, we can hardly navigate medical insurance. So I can't imagine how overwhelming it is for somebody coming from a completely different country and health system and not speaking the language to do that. And I think it's also really interesting, both you and Nuni pointed out how sensitive refugee medical care is to the current political climate, right? With the numbers dropping really dramatically during the Trump presidency and then rising really quickly after this Afghan crisis. So, and there's a lag time between when that happens and how quickly we can scale up our efforts. So that's a really important lesson there. So thank you for sharing with us. We have several questions coming in. We do have a few minutes for Q&A at the end, and then also at the end of the second panel. So we'll try to address some of those, but I do want to introduce our last speaker for this half of the symposium. So our last speaker is Gulshan Yousafzai. Gulshan is the Executive Director of Muslim American Society's Social Services Foundation, or MAS-SSF. She has over 17 years experience in nonprofit administration and mental health policy and peer support. Her passion is in system change for the underserved community, and as the first Executive Director of MAS-SSF, she has grown it dramatically from 0 staff to over 14 permanent staff and 68 peer support specialists. And along the way, she has built a broad portfolio of community service offerings, including the first ever peer support program for Muslims in the US, and secured various streams of funding through city, county, state, and federal level. And I will also say on a personal level that Gulshan is really one of the names that comes up over and over when we're talking about mental health, when we're talking about the Afghan community, and she is really just a great leader in that community. So we're so pleased to have her talk about mental health and her work today. Thank you.
Thank you, Fatma, for the invitation and for your kind words. Good afternoon, assalamu alaikum, everyone. So Gulshan Yousafzai, I think Fatma already covered my professional background. Overall, my passion has always been in standing up for the rights of anyone who's gone through mental health challenges. All my career has been focused on this, and specifically working in nonprofits at various levels. But on a personal level, which something I want to just touch upon, because especially with Ms. Ghani and what she discovered, what she talked about brought me to tears. I'm personally myself from Afghanistan. I left Afghanistan when I was 2 years old. I've been in the US all my life, and I went through the refugee process myself. And so, so everything I'm doing now is something I've been through. I love what I do because it applies to everything that I've experienced, and hoping to build a system and leave a system, right? That anyone who's gone through challenges could use it regardless of who is leading it. So that's really my overall goal. And in terms of Khwajajan, what you said about what's happening to you, it's interesting that when this whole Afghan crisis happened, although I've been here all my life, and I've gone through this as a kid, and then just kind of adjusted here and figured out who I am. When the crisis occurred, it was extremely difficult. And so I could relate to you on so many levels, because you get to the point where you just don't know what's happening. So, and I think many of the Afghans went through that, and I think we're still going through it. And no matter how many times I give this presentation, I tear up, because I think it touches you at such a personal level. And because trauma has that effect, right? That when you've been through it, it doesn't go away. And it keeps on transferring from person to person, generation to generation, unless you have services that are accessible, and one that could make you feel safe and understood and relatable in terms of your culture and religion and experiences. So thank you for sharing your personal experience, because as I felt very guilty that I went through that, because I was like, I've been here, why am I getting affected? But it's all about trauma and what you go through, and until you access services that help you, it's very hard to go over that. Overcome that. So so thank you, Rani John. So just going into my presentation, if you go next. Thank you. So Mass Social Services Foundation, so just a lot of people know it by MAS-SSF. We've been around for over 14 years, started in 2007 by 20 community members. simply because there was no place for our community to go to talk about family challenges. There's a huge rise in divorce amongst the Muslim community, which of course includes Afghans. Also suicide, month by month, there were suicides within youth, and which is why we started our youth programs, which I'll talk about in a little bit. And they continue, and of course in our community, we hide that because of various reasons, stigma associated with it, the religion doesn't allow it, and various other shameful things that people hide because of family challenges. Also identity issues, and specifically mental health and wellness problems. So this agency started in 2007 and it's been around over 14 years. We'll actually next month be hitting 15 years. And yes, there are many mosques, right, in Central Valley, Sacramento. There are at least about 24, but no social service agency that focuses on this type of work, and to this, in terms of helping community members and services that are confidential, HIPAA compliant, as well as culturally, religiously, and linguistically competent. So we are located in Sacramento. However, our services are virtually accessible and offered throughout California and United States as well. Mission is to aid families, Muslim families, but really our vision is to have one of these chapters throughout the United States eventually. We do have a parent organization. There are 39 chapters, and so hopefully we'll be having one of these chapters throughout. Our services are open to anyone, but focused on refugees and immigrants from South Asia, Middle East, and North Africa, and Afghans belong in the South Asian category. And simply, we did this because simply there is no other service that is that focused on focusing on the cultural and linguistic aspect of it. Next. All programs and services are provided in 5 languages. And now we focus on these because these have the highest populations in Sacramento as well as in California. So English, Arabic, Urdu, the 2 Afghan languages, Dari/Farsi, and Pashto. All our programs have 2 components. It's focused on prevention and early intervention. And our staff, your support specialists, counselors, board, they're all immigrants and refugees. So we have a huge number of expertise, whether it's lived experience or professional. We serve 14 and up, and for anyone, we never turn anyone away. So if we always make sure we connect them to someone, since we do work with the Muslim community very closely with the mosque, but also the non-Muslim community in terms of the city, county, state, and federal government. Also, our programs are focused on youth, adults, seniors, and families. And like I said, we started in 2007, and so we have about 9 programs now. Now they're not all funded, but most of them are being funded, but I'm pretty confident that we will be able to get funding given what we're doing. Very quickly, we have Shifa for Today, which is this is where we recruited 68 community members and trained them as peer specialists, which are mental health specialists, clinical counseling for those community members that need that serious level of services. Omid for Afghans. Omid means hope. This is where we started this recently because of the Afghan crisis. Al-Afia for seniors, focused on education and services and fun activities for seniors to prevent depression and isolation. Community education. This is where we have trainings, workshops, and in 5 languages that I mentioned. Some examples are how to raise your children in the United States, how to adapt to life in the US. We have a whole series that we are conducting right now, how to deal with the cops, because how cops are seen back home, very different than here. How to navigate the health system, as Ms. Ghani was mentioning earlier. This is very important since it's a very complicated system in the United States. Again, all these are offered in 5 languages by our team of experts. And recently we opened Amana House, which means safety. It is the first Muslim shelter for women, designed for Muslim women, although it's open to all. And we just opened that up in October of 2021 in partnership with 4 other agencies, including 1 mosque. But today I'm going to focus very briefly for the time that I have left on the Shifa for Today, because I think this is the program that relates to Afghans more specifically and overall represents what MASAF does well. Next. I'm sorry, if you could go back really quickly. Okay, very quickly on our youth program, we have 3. So we have a warm line called Amala Youth Helpline. This is where we recruit youth, train them on listening actively, assessing for suicide. And so youth from our community listening to other youth and providing the whole support 6 nights a week. We also have a youth advocacy program, and then Shifa for the Future is really where we're trying to get youth trained in the next 2 years. It's a contract we received from the city of Sacramento. Right, next. Okay, so just very quickly over in terms of mass stuff, from 2007 into 2013, it was volunteer run, like I said earlier. It was found by community members. So people have a place to go to and talk to someone about their challenges and have it be confidential, kept confidential. At the end of 2013, I was hired as the first staff at 10 hours a week. And then now we're at over 14 staff and 68 peer specialists. We did not have any funding until about 2016. And so from then, overall from 2016 to 2021, I have secured varied systems of funding to be able to get to provide these services. I mean, it's wonderful to have a nonprofit and lots of community members, but when you don't have funding, you don't have TA, you don't have training, it's very hard to sustain programs and actually provide services. Next. So since I have just 2-3 minutes here, very quickly, the shift for today, what is this? It's a program that's an early intervention program that aims at to reduce trauma, anxiety, depression, and suicidal thoughts among South Afghans specifically, and it's funded by Department of Public Health. This is where, and Shifa means healing, so it's program's called Healing for Today. This is where we have trained 68 community members to become what's called peer specialists. Peer support is an evidence-based program that's been shown to be cost-effective for those who have gone through lots of trauma and are not at that level of serious mental health issues. And so because of this, we use cultural and spiritual content in our practices. And this is where our 68 peer specialists come into use and are very effective. We increase social support. Again, the peer support specialists are community members. And then decreasing psychological distress. This is where the peer support specialists approach lived experience. They know what they've been through. We train them through 80 hours of training and then monthly training after that to make sure they're able to, in return, help community members. The 68 peer specialists are not all Afghan, about 25 of them are, but they're also Arabs, Pakistanis, Indians. The reason is because many times when Afghans approach us, they don't want to talk to just Afghans because of the stigma associated. So we have, if you will, a menu of individuals and lived experience from ranging from 17 to 75 and various backgrounds. And so that way individuals can say, hey, I want to talk to this person who is, who I could connect with. We all know in terms of trauma, healing only starts when you're comfortable. And so we have the community members choose the peer specialists that they're most comfortable with. And then I'm going to go ahead and conclude since my timing's running out in terms of the official definition of what a peer supporter is. Go to the next slide. So according to SAMHSA, peer support workers are people who have been successful in the recovery process who help others experiencing similar situations through shared understanding, respect, and mutual empowerment. Again, this is the official definition. To put it simply, you take a community member like myself who has gone through this whole thing, train them, put them to continuous training, and then in return, they're able to go ahead and help out other community members move towards healing, move towards dealing with the challenges that they're going through. Since I'm running out of time, I'm gonna go ahead and stop. And if there are any questions, please feel free to put them in the chat. Thank you.
Thank you, Gulshan. That is so inspiring to hear how Mass SSF has really filled that gap of community needs that no one was addressing. And, you know, just your success in building the organization, because it's really, really challenging. We see that with RAHI as well, how challenging it is. So thank you for the work that you're doing.
Thank you.
So we have a couple minutes left here at the end for questions, and we have actually received so many wonderful questions in the Q&A from all of you attending. Many of the questions are from people asking how they can help, get involved, volunteer, and whether some of the speakers' organizations are accepting resettled Afghans or Afghan Americans to volunteer. We'll have a little bit more time for Q&A at the end of the panel, so around 1:45. But for now, I am going to ask a couple of you to answer that question. I might start with Dr. Wong, since Dr. Wong, I think you might have clinic later. How can some of our attendees get involved and help with refugee healthcare?
Yeah, so for our clinic, because we're part of a larger health system, it does have to be done through official channels. So Alameda Health System has a jobs and a career like website that people certainly should log on and apply for different roles. We've got multiple clinics and multiple hospitals. And I think all of our sites, we have a site in Hayward and a site in Fremont, actually, where many Afghans have resettled. And so I think, having people who are culturally concordant would be fantastic in those sites. Eastmont as well, we have a lot of patients here. So certainly apply to those sites. And then we also have a volunteer program. So if people can reach out to the Alameda Health System volunteer program to ask about whether there's any opportunities.
Okay, thank you. And Gulshan, how can people get involved with MES SSF if they want to volunteer and work with you?
Yeah, I do have, I could put our website, an email rather, on, you could reach out to us. I think anyone really who's interested in helping refugees, specifically Afghan refugees, we could have you go through the training that I just mentioned. It's actually worth $3,000, but we get it for free because of contracts that are being given in the state. The training is done by another agency. And this training, even if you're not going to use it to help the community, it's good for yourself in terms of how to deal with challenges that you go through. And it's an evidence-based practice. The other thing is we are seeing a high rise in domestic violence with the Afghan community, unfortunately, which is why we opened up the first Muslim shelter. So we can train you in any of these efforts to help out. But I just want to end by saying that we all know the numbers are up when it comes to the refugees, but I think what makes the biggest difference is having individuals who can help out, whether it's at any level, but specifically if you speak the language and you're able to connect on to these individuals, because whether it's in the school system, it's in any area, health system, community members who are trained to work with Afghans, I think is the way to go. They're not all at that level of serious mental health issues. They come with a lot of trauma, but those can be prevented if we have community members who are trained to help out.
That's very helpful, Gulshan. And yeah, being from the community and being flexible about fulfilling what people need is important. Another question for you, Gulshan, that came through on the Q&A is, which counties are served by your peer counselors? How are the referrals made? And do you have any educational materials that you can share about these topics, navigating the health system and things like that?
Yeah, so we're located in Sacramento County, and so that's the primary county we serve. However, like I said earlier, with the Afghan crisis and COVID, since all of our programs are virtual, we actually get requests from all over US and outside of US. So pretty much we can help with any of the counties, keeping in mind that it would be virtual outside of Sacramento. How do we do referrals? So if anyone who needs help, they can just reach out, and I'll put our phone number and email in the chat. Again, basically you just reach out, and we have an intake coordinator who does an assessment to help anyone who's going through challenges, and then from there the intake coordinator lets the client choose who they want to talk to. Like I said earlier, you might be Afghan, but you might want to talk to an Arab or Pakistan or Indian. It is your choice where your recovery starts. And then there was one last question you asked me.
Any resources that you can share about navigating the health system?
So yes, we have a presentation that's coming up, and we could share that. In fact, we Once it's scheduled, I could share that with you, Fatma, to send to everyone. In terms of sharing the content, I would have to ask the presenters first.
Yeah, so we are going to be emailing everyone with a few different materials after this event. And so we can include lots of different resources from any or all of our speakers at that time. And we are coming up on our break. It has been a really action-packed hour, and I think we've all learned a lot. So I want to have a huge thank you to all of our speakers in this first half. We're going to do a 10-minute break and restart at 1:15 p.m. to hear from the remainder of our speakers. We have some really great topics coming up, and Nasreen Abu Damus will be your moderator for the second half. So stay with us, and let's take a little break and come back in a few minutes. Thank you, everybody.
Thank you.
Hi, everybody. Hi, we're going to go ahead and move forward with the second half. Thank you all for joining us this afternoon. My name is Nazarene Abadamus, and I'm a healthcare provider, educator, and have been working very closely with Dr. Karaki and the team on RAHI for the past 4 years. I'm very excited to be leading the second group of remarkable and resilient panelists. This second part will focus on resettlement and social determinants of health in the Afghan newcomers. We'll begin our panelists with Melanie Puente. She comes to us from International Rescue Committee, also known as IRC, where she is a health and wellness coordinator in the Oakland office. Prior to IRC, Ms. Puente worked for various agencies, implementing and coordinating programs in hospitals, in schools to support vulnerable populations in Central America and West Africa. Ms. Puente is the daughter of Ecuadorian immigrants. She completed her education at Duke University, and now she has returned to her native roots here in the Bay Area. Let's welcome Ms. Puente as she shares more about the resettlement process here in the Bay Area.
Thank you so much, Nazarene, for that warm welcome. And it's great to be here with you all today. As mentioned, we'll be going over the resettlement process from the perspective of a resettlement agency, noting, as you've already heard, that this was not a clean process, and it's also something that looked different for different individuals. So going to give a kind of brief overview of what that could have looked like. As you all saw with the media coverage, following the crisis in Afghanistan, refugees were fleeing the country, and a majority of those wound up on one of 7 lily pads, which were various locations across Europe and the Middle East. And those lily pads are areas where refugees either arrived on their own or were processed through various resettlement support agencies abroad. And that was one of the first touch points. Following the lily pads, the process continued with some form of border patrol with the Department of Homeland Security, after which refugees arrived in one of 8 safe havens in the United States. These bases were spread out a little bit across North and the Midwest. And this is where individuals began receiving services, as mentioned, some of the early health screenings, COVID testing, in addition to hummingbird numbers, which were identification numbers, and then began the process of being allocated to a resettlement agency. And that's something where logistics are being held by the International Organization of Migration. There's a variety of factors that goes into what that decision looks like, including capacity of resettlement agencies such as the International Rescue Committee. To give a little bit of background, we are one of 9 RAs in the United States. We have 26 offices alone in the US. So there's a variety of areas where families could go. So some of those were due to capacity or also with US ties. So looking at where a family might have support and as much as possible prioritizing those systems. In addition to that, there was also, as mentioned, independent departures from the bases for various reasons, meaning that these individuals would then be holding the transportation aspect on their own, were provided with information about services, but again, would have to navigate that without the support of a resettlement agency, unless once they arrived at the location of their choice, would attempt to seek out support from an RA. In that case, given the capacity that we were seeing, a lot of those families ended up on wait lists, and some of these were speaking for the offices here. Some of those were unfortunately weeks to months of wait time before families were able to potentially get services. And that's another thing. For those that were walking in, we actually had to submit applications to be able to then have those families be formally allocated to our resettlement agency to be able to provide services. And once that allocation happened, they would be getting the same support services as a family that was allocated by IOM. And that would be entering into the resettlement and placement program, which is a 90-day program with a variety of support, but really looking at identifying that safe and sanitary housing, that temporary housing, and then hopefully identifying a more permanent housing down the line, tapping into public benefits such as Medi-Cal, CalFresh, connections to English language learning, obtaining that first job, legal aid with remaining immigration steps, and then orientation to customs, culture, and laws in the US. And going into a little bit of challenges, something that we saw, especially with this crisis, is that a lot of US ties in the past have been very integral in doing some of those services. For instance, oftentimes they were the ones that were meeting families at the airport. They were temporarily housing families, and then also were providing sort of ongoing cultural orientation, which was very, very helpful. And what we saw this time around, for a variety of reasons, is that the US ties were not always in the position to be able to provide the support. And a lot of times that was actually because their families were struggling on their own, trying to navigate post-COVID realities. So they were not always able to provide that support. So that's one of the challenges that we saw. And that also tied into the overall housing challenge. As you all can imagine, in the Bay Area, housing is quite complicated. And then adding in the factor of looking at temporary housing, thankfully we were able to through various partnerships and funding, be able to house families in hotels, but also with companies such as Airbnb, being able to make those temporary housing arrangements work while attempting to find permanent housing. So all individuals are eligible for a one-time stipend of sorts from the federal government, which is just over $1,000 per individual, and that's a flat rate across the country. So for the Bay Area, that very often does not cover first month's rent in and of itself. So to attempt to find a permanent housing situation with no current income other than that stipend is quite complicated. And then with that, in addition to the moving around, as mentioned, not just between temporary housing situations, but also from the bases, a lot of paperwork was lost in transit. So that includes employment authorization and social security cards. And that's something that then further impacts families' ability to be able to get a job, apply for benefits. And we just saw that those applications would needed to be done again, also overwhelmed a system that was already very strained. So as previously mentioned, also looking at the capacity and the need to staff up, as well as having these agencies being trained in how to process with this legal status, the humanitarian parolee status, how do you then process this paperwork for these individuals? And then looking again at the broader looking at staffing up, that's also something that resettlement agencies experienced with the previous administration, the decrease in funding, decrease in program services, and then with the sudden post-crisis in Afghanistan, the need to very quickly staff up and not only train staff in how to manage these cases in terms of the complex nature of them, but also in how to themselves hold the vicarious trauma that they were seeing coming through these families and how to support the families during that. So that's also something that we saw from our end as well. So that's a little bit of a kind of broad overview, but I'll also go into just a couple case studies to give a little bit more sense of some of the families that we were seeing come through our office. As mentioned, there were a couple of pregnancies. So we did get a wife and husband that arrived in November. They were picked up at the airport by our team. The wife was pregnant and due around April. It was a high-risk pregnancy. There were a history of previous miscarriages. And then the husband was experiencing difficulty obtaining a job with a delayed EAD card. And he actually cited that as a reason for his declining mental health. And that case actually ended up being flagged because the husband began with everything that's going on, everything so overwhelming on top of the trauma that was experienced, began shutting down and wasn't able to on his own do day-to-day tasks. So that case got flagged for us. And then also, and with that, for the wife's mental health, because she was also trying to navigate her own pregnancy and support her husband. So with cases like this, a lot of hands are kind of touching the case in terms of prevention and early intervention, looking at stigma, looking at also doing that education of what does mental health look like in the United States. That very often means something different here. And then thankfully with this family, the husband about a month ago was able to get a nighttime job as a security guard, so starting to get a little bit more sense of also what we found that has been or heard that has been helpful is having also just a routine in place. So having somewhere to go, something to do, and on top of the just logistical help of getting that income. And the wife actually gave birth to a healthy baby girl earlier this week. So they are over the moon, very, very busy, but very happy with the new addition to their family. So that is one case that came through. And then we also had a couple single-headed household cases that look like a variety of compositions, but in one case, a mother and husband with 6 children arrived at a lily pad abroad, and then 5 of those children, some of which were under 5, and the mother continued through the process, arrived in October to the Bay Area, were picked up at the airport by our team. However, the husband and the oldest son were still on a lily pad abroad. So the wife had to very quickly adjust to doing things on her own without her partner in a new country, limited literacy in her own language with no English capacity. And with that, case was also very housing focused, especially with very young children. Having that sense of stability is something she identified as being quite important, and validly so. However, with occupancy laws, the level of income that she, as the only adult, would need to then cover rent for a 3-bedroom apartment in the Bay Area, plus childcare, plus other expenses, is a very tall ask. Thankfully, just about a month or so ago, because of cases like these, a program came about that actually is being able to provide longer term rental support. So they're providing 3 months of rent and then scaling that percentage down to be able to provide families with a little bit more time to get adjusted and hopefully obtain some form of income. So they were actually able to sign a housing lease just 2 weeks ago. Our team helped them move into an apartment, and we're hopeful that this also allows a little bit more kind of brain space to be able to look at other areas of support, such as addressing mental health. As you can see, there is a good amount of work that's going on there. So I know we're a little bit at time, and just wanted to give a snapshot of these 2 families that are 2 of the 674 individuals that our office has resettled since October. And just again, that's not something that we can do alone. It's something we do with the dedication of our staff, but also the partners and community as a whole. So thank you all for listening, and happy to answer any further questions.
Yes, thank you so much, Melanie. It's very heartwarming to hear your stories of success in the community, especially the one of, the mother delivering a healthy baby. Thank you for the work that you're doing. Moving on, we'll begin with our next panelist. She's an ambitious, dedicated young professional, and of course, dear friend of mine, Miss Aisha Ifran. She's a community organizer, advocate, and public policy professional who has spent the last 10 years building and leading successful legislative advocacy campaigns. Currently, Ms. Ifran has worked for Airbnb's public policy team as the senior policy manager, leading their work in major markets across the West Coast and the United States as a whole. Over the course of Airbnb's Afghanistan response, she led the local policy and partnership work across the United States. Ms. Ifran is involved in many community organizations and much more. Perhaps we'll see Ms. Ifran running for Congress or maybe on the next presidential campaign. Without further ado, it's an honor to welcome Ms. Aisha Ifran.
Thank you so much. That was such a warm welcome, and excited to be here. I'm excited to move on to the next slide. Fantastic. So as Nasreen mentioned, my name is Aisha Irfan. I am a senior public policy manager at Airbnb. I manage in my day job our day-to-day government relations work across much of the West Coast. And in August, when we launched our Afghanistan response, was looped in to lead local policy and partnerships work across the country, primarily in the areas that we're seeing the highest number of Afghan arrivals. So that was NorCal, SoCal, the DMV area were huge, huge targets. And so worked really closely with a cross section of partners. I see some familiar faces on this call, so it really reminds me that this work is going to continue to take all of us. I think this forum as a whole, having a cross-section of practitioners and advocates and community leaders, to me just shows that facilitating belonging for Afghan newcomers, for any newcomers, really will take all of us doing our part and to ensure long-term success. I'm here today to tell you a little bit more about our program and then happy to answer any questions. Next slide. I'll give you a little bit of background on Airbnb.org, which is the 501c3 arm of Airbnb. I'll tell you a little bit about our Afghan commitment, how the program itself worked, and what's next. Next slide. So as I mentioned, Airbnb.org is an independent 501c3 nonprofit, primarily founded to facilitate temporary housing for people in moments of crisis. In the past, this has included disaster survivors and evacuees, COVID-19 frontline workers, and refugees and asylum seekers. Our refugee and asylum seeking program was launched in 2015, unofficially, and then more officially launched in 2017, right after Trump's travel ban came into play. We wanted to do our part as a private sector company to say that we want to continue to facilitate belonging and use our platform to do that across the world. Next slide. Specific to our Afghan commitment, in August 2021, 120,000 Afghan folks fled Afghanistan seeking immediate safety. And up until this point, more recently, when the Ukraine evacuation started, this had been the largest resettlement in the course of US history. 80,000 people were on military bases across the country this fall. And in days after the Taliban takeover of Kabul, Airbnb.org announced that we would help provide free temporary housing to 20,000 Afghan newcomers in partnership with resettlement agencies and nonprofit organizations. Our hope was that the Airbnb community could make an impact and really provide a warm, safe welcome for those touching down for the first time here. Next slide. We did this in broad and deep partnership with elected officials, with community-based organizations. If you look at this picture on the right with Mayor Steinberg in Sacramento, you may or may not see a familiar face. This is a press conference we did with Gulshan and local partners in the Sacramento area. And it required a high degree of collaboration between the federal government, between local elected leaders, between local Afghan volunteers and activists on the ground. I think everyone was receiving different information at different points in time. And so really for us as a private sector partner, highlighted the need to have a 360-degree view of what was going on and to make sure that we were in community with all of the people involved who had different information to share. Next slide. Given that we announced our commitment within a week of Kabul falling, we actually started receiving a lot of inquiries directly from other private sector partners to say, hey, what can we do? How can we help? Who should we be talking to? And so this wasn't a role that we anticipated or specifically asked for, but it's one we found ourselves in. And it was a responsibility we wanted to take really, really seriously, of making sure that there are a high degree of efforts within the Afghanistan response that are funded, that are people's immediate reactions for where funding should go. And our resettlement agencies are phenomenal partners. But so much of this work was being done in, entirely unfunded by people self-financing hotel stays or laptops for community members that were coming in. And so we wanted to continue to be a thoughtful, engaged partner there of how do we create systems and processes to fund that work that historically has been underfunded, one, and then two, how do we facilitate broader private sector connections for these smaller organizations and the private sector. Next slide. So how do we do? In just 6 months after we announced that commitment, we actually surpassed our goal. We have provided temporary housing to over 24,000 Afghan newcomers. And this is in partnership with the resettlement agencies. You just heard from the International Rescue Committee, which is a long-term partner of ours, and some smaller organizations. We had a community of hosts who generously offered their homes to incoming refugees for free or at a highly reduced cost. And Airbnb.org was able to house nearly 1,300 additional newcomers due to the generosity of these hosts. How it worked. I'll tell you a little bit about the program itself. Next slide. Airbnb.org fully covered the cost of these stays. Up to 30 days was the initial offer, but as you heard, long-term housing continues to be one of the biggest needs, especially in pricier jurisdictions like the broader Bay Area. And so we have found that a lot of those initial 30-day stays have extended out into 2-month stays, into 3-month stays, as resettlement agencies and nonprofits are working around the clock to make sure they can find sustainable long-term options for families. We operated in the US, Canada, and the UK. Airbnb hosts and other community members signed up on Airbnb.org to offer their homes for free or discounted rates. And the other thing that actually ended up being helpful was within broader Afghan diaspora communities, so many community members wanted to offer up their homes, but logistically it was hard to coordinate. And so we went ahead and we were able to provide that platform. So in the state of Washington, there was, I think, a volunteer base of 1,100 hosts who said, I want to sign up to host some newcomers. And so they all, we provided the platform where they went live on Airbnb, were able to offer their homes for a discount or for free to be able to book. And then the final thing I'll mention here is housing is directly booked by Airbnb.org partners. I think we want to be trauma informed and super conscious of making sure that there is a mediator and a facilitator so that our nonprofit partners really play that role of they are the ones directly interfacing with guests. They are the ones who know the most about the refugee resettlement trajectory. And so we want to make sure that we are doing our part in terms of providing funding and really amplifying the efforts of our nonprofit partners. Next slide. I think the other thing worth mentioning is there is an entire ecosystem that exists of how refugee resettlement happens. And it was really important to us to become a central part of that broader ecosystem. And so there are 9 national resettlement agencies across the country. This includes the IRC, Church World Services, HIAS. Pre our Afghanistan response, we were working with 3 of the 9. We then went ahead and expanded our partnerships to work with all 9. And this is a quote from one of our partners in the immediate days after we launched our program. Airbnb's commitment to this crisis has sparked a momentum with other partnerships we can't begin to describe. Hope your team is feeling proud of the movement you've sparked today and within the private sector. Second, there are a host of Afghan-led community-based organizations across the country that we're now having to do resettlement work when historically that's never been their mandate. It has been a little bit more direct services. And so we wanted to make sure we were providing additional funding directly to Afghan-led organizations. And then finally, as I mentioned, so much of this work is being facilitated by Afghan-led volunteer efforts that volunteers are leading directly on the ground. And these are historically the least funded efforts that we find. So when we launched our program in the immediate days after, we were in touch with a local volunteer group that was helping evacuate Afghanistan's all-female orchestra that we helped provide temporary housing for as they sought longer-term options. Next slide. A little bit more about our guests and our hosts who make this possible. This is a quote from an Afghan newcomer named Shaheen, and she said, "I feel like I'm staying in my own house, even though I don't know this area, I don't know the people. I feel 100% safe, and I'm happy here." For us, I think the warm welcome a home can provide, and a degree of like agency and dignity for newcomers, where you are able to be in a little bit of space. You can leave, you can go on a walk around the block, you can cook your own food. That was something we heard time and time again from our nonprofit partners, that provided a really powerful avenue to make sure that folks could be themselves in the spaces they were in. Next slide. This is a host in Seattle, Aaron. He and his family had an in-law unit, a 2-bedroom apartment near downtown Seattle that they went ahead and 100% donated for a year. to a family to use. So just as I mentioned, long-term housing options continue to be a struggle, but this was something Erin was able to offer, and there were multiple stories just like this. Next slide. These are Brianna and Mark, hosts in Dallas, Texas. They were hosting an Afghan newcomer family and hosted them for a few weeks. Their children became friends in Dallas. The resettlement agency, interestingly here, was able to find them a long-term option. And so as they were getting ready to move into their long-term apartment, the Afghan family actually said no, that new apartment was too far from these hosts who they'd befriended. And so I think, to me, again, like when you're coming to a brand new country and the very first kind of relationship you build has the potential to be so impactful. And the resettlement agency ended up finding them a home much closer to Brianna and Mark. And so they've officially resettled into their permanent home. Next slide. What's next? Let me tell you a little bit about that. We unfortunately know that we're living in just several moments of crises and compounding crises. So last month, Airbnb.org announced its commitment to housing 100,000 Ukrainian refugees. And so we're going to continue to be a crucial resource for newly arriving Afghans and folks from the Middle East and Central and South America, with the goal of providing housing to an additional 20,000. And so launched a Ukraine response recently, and then continuing to work in the regions we've already worked with these, with the Afghan refugees. From the beginning of this work, we've really wanted to continue to call on the broader private sector. As someone who comes from the public sector, I spent a good decade in nonprofit work, in government relations work, working for an elected. I think now being at the private sector, it's become really, really clear to us that the private sector does have a role to play. And so what is that role, and how can we continue to both be a leader and a facilitator in this broader space? Continues to be a priority. And with that, I will pause. Thank you so much for having me today.
Aisha, thank you so much for that. You know, in these forums, we often see a lot of nonprofit and a lot of governmental agencies and stuff usually addressing the care. It's nice to see that a private sector has also come into the arena of helping refugees. So thank you for all the work that you do. Our final panelist comes to us with a unique and inspirational story as one of UCSF's sponsored scholars. Ms. Seema Nedri came to the United States in January of 2022 and began her master's in global health at the Institute of Global Health Sciences at UCSF. Prior to, she completed her undergraduate and master's of public health degree in Kabul University of Medical Sciences in Afghanistan. She has ample experience. She has been a research assistant in various health-related research projects and organizations in the following positions: data analysis at Can Health International and University of British Columbia, Canada, co-investigator of the National Mental Health Survey at the Governance Institute of Afghanistan, and co-investigator of quality research at Jesuit Refugee Services in Kabul, Afghanistan. We welcome Seema to share her story. Seema, welcome.
Thank you, Nesreen. Hello and good afternoon, everyone. Thank you for inviting me and giving me the chance to speak to this important event. I will share you some sort of my personal experience from Afghanistan to United States, and definitely I will start from 50 August and so far. After 50 August, for 3 months, I was like prisoner at home while I was suffering stress, anxiety, feeling of fear, helplessness. I even have nightmares. Whenever it comes to my mind and thoughts, I have no job, no educational opportunity, and no future at all. It gives me to feel like I was gradually dying. As I faced millions of challenges and hardship to finally make my education to be done and made my career in Afghanistan, and I lost everything after then. I remember I started school from UNICEF tents where we had no classroom. as all classrooms were destroyed during civil war in Kabul before 2001. Sorry. Even having that things were privileged for us at that time, because at least we had the chance for education. But for now, my sisters, my siblings has no chance, and my compatriots as well. During my undergraduate, I had many challenges, but not oppressively, in living in a conservative society where girls' higher education and working in a mixed environment matters. From other side, Kabul was not safe even before Taliban. However, we had the opportunity to work and education between 2014 and 2021. This is the years I started studying at university and work. Or in other words, I was outside home usually between these time periods. I survived many explosions safely on my way to home, to work, and to university. But the most horrific one was Kabul University attack. I want to share you briefly some story and my experience at that day that unfortunately I will never forget that. When we got informed that gunmen came into university campus, me and my colleagues were stayed stuck at university during attack. After some minutes, we all gathered in one of the classrooms until we were escorted by university guards to perimeter walls instead of gate, as the gates was under control of gunmen. On our way to wall, I was hearing the screaming and panting voice of students and guns shouting were very close to my ear, and I still remember that. And it was very loud. By a very hard gunshot sound, everyone separated from each other. Once I see around myself, I see no one is around me. I just start screaming and asking for help. One of my friends came and helped me to go through to the perimeter walls, and we were scrambling over perimeter walls. After many attempts, finally I can get to other side of wall and keep escaping the area, and hopefully we were safely escaped the area. Actually, I'm telling this story to say that we studied and worked under such situation. I'm not only the one to go through this experience. Every woman in Afghanistan had the same problem and have the same challenges. Sometimes it was more painful for me while I was in Afghanistan and I'm here as a part of society, being witness how our homeland is getting destroyed, how my compatriots are killed at Kabul airport and how they flee in the country for a safe and better life, how they are torturing on their way to other countries. This was how life goes in Kabul. Now, I'm gonna say some good story. Finally, after 3 months, I received my passport, and following receiving my passport and keeping contact with UCSF team, I plan to go to Pakistan to receive my US visa, as there was no embassy of United States officially in Afghanistan. It was in November, late November, around 10 p.m. It was during night. Me and my father decided to go from home to a Torkham bus stop in Kabul. After hours of waiting for a car, finally we got to Torkham border at 5 a.m. It was already morning. Then it takes more than 3 hours to cross the border by walking. It was hardest trip I have ever had in my life. I was totally covered by hijab, and it was hard to breathe sometimes. And sometimes I was too tired. I started to sitting on the ground to take a rest, but the Taliban soldiers were not allowed us to sit because they make the line arranged. So they have a pipe and cable, beat people with that cable. Actually, and hopefully they did not beat me, but they did my father with that cable and told to the woman with you, don't sit on the ground and stand up. So anyway, I go through the border and get into Pakistan, and it takes 1 month to come to United States from Pakistan, hopefully. On my way to United States, when I was in airport, I was thinking, oh, and that is that. No more worries, no fear, and it is really, and it was really, but not as much as I thought. after coming here to San Francisco. However, the UCSF team and my professor keep contacting me and providing me what I needed. I had no problem in insurance because I had already have insurance and system navigation, especially as I was guided by UCSF team. I believe without helping them, without helping the UCSF team, I was not able to manage resettlement here, as it was very my first time to come to United States. And the system looks like very complicated for me. And I was confused with everything. And I thought it may take many years to get resettlement in United States and get familiar with everything, especially with technologies, with anyway. But I have another sort of concerns when I got here. I was feeling so alone without family. It was first time to separate from my family. Even sometimes I feel guilty and keep asking myself how I left behind my beloved ones in such a dire situation and come and save my own life. I don't know, maybe it is due to a sense of responsibility as an eldest sibling or daughter. I don't know what is this. I have this feeling anyway. Another thing is the first month after arriving here at the United States, actually the first month was the worst. I was crying every night. I was not able to sleep and had nightmares. I missed my family too much, especially my small sister. Her name is Bushra. She has only 6 years and she's very cutie. Actually, I miss my family all the time, especially I'm talking right now. I miss my small sister too much. One of the reasons I'm concerning a lot about my family is that the situation in Afghanistan is getting worse day by day. In 3 April, there was explosion in Kabul, capital of Afghanistan. This is April, just in the month we are here. My father was just around the explosion area and he was fainting and fell down to the ground for a long time in the area. And then some random guy helped him to go back home. Fortunately, he survived the blast since he was as away from explosion as not to be killed or severely injured, but the shock and panic of accident make him to faint for so long to the ground. Actually, whenever I think what would happen to my father, to a man suffering from diabetes, hypertension, faces another shocking blast or explosion and gets syncopated if he was lucky to be survived. Would my father be strong enough to cope the situation and keep responsibility of his 8 children in Afghanistan? These questions are like punch, hide my brain all the time and make me feel down and down. Last but not least, as an Afghan, I think and feel that we will never be happy and comfortable unless we are being confident that our families and compatriots are doing well, they're safe, they have enough to spend for food, and at least for food, and their human rights are practiced well within society. But unfortunately, things are going exactly on the opposite side as we do before. Thank you.
Thank you, Seema. Wow, what a story. It just shows one's inner resiliency to get to where you are. Your story is incredible, and I'm sure there are many that share stories similar to you. And so it's our responsibility to all work together and to help the Afghan and other disadvantaged populations here and abroad. So thank you so much, Seema, for your story. Looking at the time, we only have a couple more minutes left. So we're going to go ahead and take a couple of questions before we go ahead and end. This question came from one of our spectators. I'm a family physician in Arizona seeing large Afghan patients. Is there a national dialogue forum where we can meet on Zoom and collaborate and exchange ideas? That's a great question. I'm going to give it to Dr. Karaki. Maybe you can help address this.
Yeah, thank you. Thank you very much for that question. I think there is the Society of Refugee Healthcare Providers, SRHP, which is an organization made of healthcare providers primarily in the US and Canada. Full disclosure, I'm on the board of that organization. And so I wonder if the attendee who asked that question is part of that, since we did send out the event through their listserv. A lot of times though, when I need a group like that, especially being the director of RAHI, I just go ahead and create it. And sort of once you create it, word gets around and others join. So I would encourage that person. We can certainly facilitate that partly with some of the providers and people that are on the panel today. So if that person wants to email us, maybe we can go ahead and start that up if it doesn't already exist. Our email is rahi@ucsf.edu. And I also wanted just to say thank you to Seema for sharing your story. It sounds like, I think that just one of the things that we most take for granted here in the US is our sense of security and like just sort of being safe. That's something that unless your safety has been threatened, it's not really something that you realize how valuable it is. So it was really difficult to hear your story, but I wish you and your family the best.
Truly. We have time for one last question. So this one comes and it says, what are the next steps for those who have humanitarian parole status since it's temporary? And that's something I'm actually very interested in as well. Perhaps Melanie, maybe you can help us with this question.
Sure, I can speak a little bit to it, though our immigration team would be a little better positioned to do so. But yes, it is a temporary status. And that's also something that is continuously changing. But right now, the last that I heard, that's something that more than likely will go into individuals applying for asylee status. And that's something that is more permanent, as the humanitarian parolee visa is temporary, though they're looking at potentially expanding the length of time that status is eligible for, just given acknowledging also the number of people that have that status, and that would need to then look at doing that legal change. But yes, that's something that is a little bit changing depending on what's going on. But
thank you. I think for me, one question that just keeps coming up, and I'm sure many of you are also thinking about this, is there's so much that can be done, but where do we start, us as individuals? And so I posed this question to the entire group, similar to what Dr. Karaki proposed to the first panel, is what can we do to help? And since we're running so short on time, and I desperately want to know the answers from all of the panelists, I was hoping maybe everyone can answer that question in the chat group before we conclude, because I think all of us are curious to know how we can help with our respective roles in the society. Being mindful of the time, I want to switch over to Dr. Eva Raphael for closing remarks, if that's okay.
Thank you, Nasreen. Well, it was wonderful to hear both from organizations that have rallied to help out during refugee crises, but also to hear from individuals. And thank you so much for sharing your stories and really providing a very privileged window into your experience, because I think that you can read BBC News all day long and get to hear journalistic stories, but it's another to actually hear from someone what their trajectory and experience was. So I wanna thank you all for joining us, and we hope to put this, so we'll be sending out a survey for next year so that we know what we should change. As was mentioned before, RAHI is all volunteer based. So if you want to learn more about RAHI or provide support, you can use the QR code to find out more. And yeah, Nasreen, I really like this question that you posed at the end. What is it that people can do? And I think that involvement can happen in many ways. It can be at the organizational level, it can be at the individual level, and one just has to see which way, you know, fits their time and their commitments best. But I think today we got a really good sense of the many ways in which one could be involved in this work. Well, thank you so much. I think we had a wonderful 2 hours, and I look forward to this next year again.
Thanks, everyone. Thanks to our panelists and speakers. Great to see everybody.
Thanks so much. Thanks, Dr. Karaki, for leading this endeavor.
Couldn't do it without you all.
Thank you, everyone.
Thank you.
Thank you. Thank you, everyone. I hope for next year we have good stories to share.
I'm sure we will, Seema. Thanks for coming and joining us.